Hello to everyone joining us. We still have a few folks joining the webinar, so we're going to give them maybe another minute or so to join us, and then we're going to get started with today's session. Thank you for being here. All right. So we have about 62 people in the room. I'm going to go ahead and get started with the session today. Welcome to NASDAQ's PrEP Navigator peer-to-peer support group. So welcome and introductions. All right, so everyone, my name is Roderick Shepard. My pronouns are he, him, his, and I'm a manager on the prevention team. And what you have here is the PrEP Navigator peer-to-peer group. We have my lovely colleague here, Nicole F. Null. She's a senior manager on the prevention team as well. And Cody could not be here with us today, but he's also a member of the PrEP Navigator peer-to-peer support group. And so I wanted to get into the agenda for today. So we're going to take a moment to kind of review the purpose and the goal of the PrEP Navigator peer-to-peer group. The first initial session was restricted to the EEG jurisdictions, but I was able to obtain approval from my partners at the CDC to expand the group to include members of NASDAQ and as well as community level service workers to increase the number of conversations that we can have and support that we can have amongst PrEP navigators. So I'm really, really excited that we'll be able to expand the group. I got a lot of emails about this. So this is where I wanted to run over that one more time for anyone who might not have been in the space prior. And then so we have a presentation on PrEP navigation within PrEP clinics and mobile health initiatives presented by Kevin Contreras and Nancy Godson. I hope I said that right. And then before we have a breakout session, we want to just have a brief overview of PrEP delivery models. And we'll have a breakout session with some questions to get you all in the room and get conversation started. This is a peer-to-peer group, so a big purpose of this is to get to know your peers, understand some of their opportunities, some of their strengths, and how you can help each other out. So we wanted to get everyone in the room together. And then finally, we're going to talk about some next steps and closing remarks. So without further ado, I'm going to go ahead and wing it over to Kevin and Nancy to talk about PrEP navigation and PrEP clinics and mobile health initiatives. And they work with Whitman Walker Health, who is my former employee. I used to work in a PrEP clinic there, and Kevin was like a brother to me because we worked very closely when he was the PrEP navigator and I was the PrEP specialist there in Whitman Walker. So I'm going to go ahead and hand it over to the Whitman Walker team.
Thank you so much, Roderick, for that kind introduction. Thank you for having us, everyone, in this virtual space. My name is Kevin Jordan Contreras, pronouns he, him, they, them. And I don't use Zoom a lot, so I am going to take a couple seconds to share my screen to pull up our presentation that we have prepared for you all this afternoon. So let's see. I hope I don't break anything. Let's see. It's been a minute since we mostly use Teams, but I think I got it. Share. I think you all can see my screen, right? Or at least my desktop computer. So I'm going to start the presentation mode. And I have with me as well Nancy Gatson, our bilingual PrEP navigation care coordinator. Once again, my name is Kevin Jordan Contreras, Prevention Programs Manager. In our call present is also our Senior Director of Community Health and Wellness, Juan Carlos Lubriel, pronouns he, him, él. As you can see, we love long titles at Whitman Walker Health. So I just wanted to start with a little bit of background about the work that we do at Whitman Walker Health, particularly around PrEP and PEP. Our goal, of course, is to reduce the number of HIV infections among vulnerable populations to HIV, such as men who have sex with men, trans folks, youth. We want to increase the uptake of PEP and PrEP within these communities. We have health educators that provide information, do all forms of outreach, whether it's internet outreach, street-based outreach, venue-based outreach. It's important to present this information to community, right? Likewise, our community health educators and sexual health clinic staff members, we conduct a risk assessment, right? So we want to evaluate the eligibility for patients and clients, and be able to link them to those services. We have medical providers who also administer sexual behaviors and risk factor screenings for patients, which would indicate, right, an eligibility for PrEP. We're trying to do this in a status neutral approach. So I know that's been a term that you all may have heard recently. The idea that it doesn't matter where someone is, as far as accessing services, it should be done in a status neutral approach. So that's something that we try and strive for. We launched our PrEP clinic back in 2018. As Roderick mentioned, we used to be coworkers and colleagues. Actually, Roderick was at one point training me and mentoring me to be able to do phlebotomy and conduct visits for PrEP patients. So I've known Roderick for a while now, and it's so great to be here with him in this space. It's amazing. So thank you. And thank you for inviting us once again, Roderick. But the general idea of the PrEP clinics that we're combining lab work, visits with actually getting your medication. For patients that are using our pharmacy, we have their medication ready to hand them out to them. And then patients walk out with an appointment, right? Because we know that that's really important. Folks are scheduled every 3 months for oral PrEP. And this is just to facilitate visits. We have our scheduling method is also super accommodating, meaning that if someone has any issues coming in because of hours, we're able to accommodate them with different hours through our PrEP clinic schedule. And so this is just some posters that we have when we hand out to folks and telling them about our PrEP clinic. I would like to present to you some stats and talk to you about some trends that we're seeing as far as Whitman Walker Health and the patient population that we're seeing. So where do our Whitman Walker Health patients live? So as you all know, we're located in Washington, D.C. Washington, D.C. is sort of like a tri-state area, since we have Maryland, we have Virginia, we call it the greater Washington metropolitan area. We also have West Virginia really close by, and Pennsylvania too. So the majority of patients are, of course, from DC, Washington, DC. 18% of them are from Maryland, 13% from Virginia, 1% is from others. And then DC, the District of Columbia, is actually broken down into different wards. So that's also really important, because we know that historically, as we call it here, east of the river in Anacostia, wards 7 and 8, it's where we see more discrepancies when it comes to access for services. We see other things like food deserts. We see higher incidence rates for STIs and HIV compared to other wards in DC. We serve a wide range of patients, but the majority of our patients range from ages 20 to 49 years old. We do see youth patients and folks under 18, of course, but as you can see, the majority of our patients are from 20 to 49 years of age. We work a lot with minority populations, particularly around with trans-identified folks. So we have 15% of our patients who identify as transgender. 4% of them identify as gender nonconforming. And we do see a lot of trans women, but particularly a lot of patients who are, just of different identities. Now, when it comes to sexual orientation, so Woodman Walker Health, we've been known as a queer clinic, always there for the community since we launched. So we do have a lot of patients who are from the LGBTQIA spectrum. And when it comes to HIV-related care, 78% of our patients or patient population is HIV negative. We know that the social determinants of health are really important. So housing is a big factor when it comes to someone being able to access services and be able to stay in care. We know that insurance access is also really important, especially now as we have new services and new prevention, such as injectable PrEP, which we'll talk more about soon. The good thing about DC is that we have a relatively high insurance rate. We have DC Medicaid expansion that is able to catch folks who fall out of, safety net when it comes to Medicaid eligibility. We're also a federally qualified health clinic, so we are able to provide folks who don't qualify for Medicaid, they qualified for the sliding fee schedule as well through our public benefits and insurance navigation team. But we do see high insurance rates in the DC area. I wanted to just really quickly talk about PrEP access at Woodman Walker Health. One of the biggest ways that people come through us to do PrEP is through our integrated HIV and STI testing programs. That's where they'll meet with a health educator to complete a risk assessment. And that's where a lot of folks will express an interest for PrEP. And usually the process is very straightforward. If someone has insurance, they'll just go in with the front desk and schedule an appointment to be seen by a medical provider, and then they'll be referred to the PrEP clinic for their PrEP care follow-up, where they'll be seeing a PrEP specialist. However, if they don't have insurance, we also have our PrEP navigators who are able to assist those patients, and PrEP navigators are the first point of contact for uninsured and underinsured patients. We also have something that's called the Mobile Health Initiative that we'll also talk briefly about soon. So talking about PrEP navigation specifically, this is something also that launched in conjunction with the PrEP clinic back around 2018. So there is a youth-focused PrEP navigation approach because we know that reaching young people is really important for PrEP. There is assistance for eligible HIV negative patients who are uninsured and underinsured. The PrEP navigators essentially help them apply for financial assistance by providing application support. And then there is an emphasis on being patient-centered, of course, focusing on adherence and retention for these vulnerable patients. It's a concierge and case management service model. I always like to think of PrEP navigation as case management for folks vulnerable to HIV in a similar way that you would have case management and non-medical case management for folks who are living with HIV. So because we want to strive for a status neutral approach, we're sort of mirroring that component through our PrEP navigation service model. And then, of course, the PrEP navigators are present to assist with rapid PrEP start through our mobile health initiative for uninsured and underinsured patients. So overall, our PrEP navigators, they educate patients, they enhance our ability to follow up with patients through the care continuum, and they coordinate along other clinical staff and departments within Woodman Walker to provide those support services for folks who are vulnerable to HIV. I wanted to quickly talk about some retention when it comes to PrEP. We know that after 6 months, a lot of people will fall out of PrEP care. And there's many reasons for that. With Walker, since the launch of our PrEP clinic, we've been able to essentially follow patients a lot more closely than we would through the traditional medical model. And so this graph, this figure right here highlights that difference between retention. So the medical side of things, those are patients that are not enrolled in our PrEP clinic. Those are patients that would just call to schedule an appointment. They would have to do it by themselves. And then through the PrEP clinic, you actually have someone actively helping you and monitoring real-time appointment windows. And that's been really effective. And as you can see, in the last quarter, we saw an increase in retention through our PrEP clinic compared to the traditional medical care model, anywhere from 10 to 15 to 20%. And some of these figures also take into account what happened during COVID and the pandemic, which we saw, unfortunately, a lot of folks fall out of care through the traditional medical care model, but including through the PrEP clinic model. As you can see, in some instances, figures range from 67 to 92% in this figure. So I'm just gonna move to my next slide real quick. And then the other thing that we wanted to touch about was the mobile health initiative. So we got a mobile unit recently that has 2 consultation rooms and a bathroom. And the goal of this mobile unit is to have a medical provider and have a PrEP navigator be able to see patients in community, meeting people where they are, and do rapid PrEP start. We know that how you can have the best medical center with the best doctors, but if you're not going out and meeting people where they are, we're not being intentional and effective when it comes to reaching vulnerable populations. I will now hand it over to Nancy Gatson to talk about our injectable PrEP/Apretude clinic at Whitman Walker Health.
Hello, everybody. This year in March, we launched our Apretude clinic embedded within the PrEP clinic. We are now offering injectable PrEP, which is Apretude, which is FDA approved, was FDA approved last year. The care model for this new treatment includes PrEP navigation care coordination, assistance with scheduling appointments, insurance-related troubleshooting. When necessary, patients and clients interested in PrEP have a consultation with the provider first before seeing the PrEP clinic for their injection. So basically, they're getting their injection through our PrEP clinic services. Apretude is, sorry, I don't see the. Apretude is offered, well, the patients can get their first consultation either through telehealth or in person, depending on how long it's been since they've seen their provider to consult. The medical provider will then determine whether they qualify or not. Providers also prescribe a 30-day supply of oral PrEP in case there is a lapse for whatever reason, if patients can't get their injection for their second dose. PrEP specialists also discuss the importance of coming to their appointments on time. The PrEP navigators stress the importance of to the patients if there's a lapse of insurance, or if for whatever reason they don't have insurance, to please inform us as soon as possible so that we can, make sure that they're covered through their new insurance. And if they don't have insurance, then essentially they go back on oral PrEP as well. As I was saying, we try to troubleshoot as much as possible any barriers with insurance by educating our patients, motivating them to be to advocate for themselves as much as possible. Also stressing the importance of coming on time to their appointments. Let's see. PrEP navigators stress the importance of adherence, whether it's through for oral PrEP or the injectable PrEP as well. We also try to keep track of if a patient misses an appointment, we try to remind them to schedule their appointments. If there is, if for whatever reason they miss their injection. Ways that we communicate with patients is through our digital platform. It's called Artera. And then also ways that we help patients for oral PrEP for applying for patient assistance program is through iAssist, through Gilead as well. Some successes have been, as I was mentioning, the iAssist platform, which is an online platform through Gilead. I believe this came about during the pandemic, since we couldn't get our patients to come in and sign because of COVID, and also the providers no longer have to. I don't have to chase basically the providers to sign the applications. From there, if for whatever reason, if the application doesn't get approved, we also have starter packs, which we have available for the patients in case there is any hiccups through the iAssist application. Another success is the Artera messaging system. As we know, sometimes our patients are at work and it's easier for them to communicate through text. So we use this platform as well to communicate with them, to remind them of their appointments or anything related about their PrEP. Some challenges have been insurance barriers. We have seen them a lot lately for our Apretude patients. Either they're not being covered, the injection isn't being covered for whatever reason through their benefits, or we're getting told they are covered and then we're having hiccups here and there. I don't know if Kevin, you want to elaborate on that?
Yeah, so we know that Apretude can be covered as a medical or a pharmacy benefit. And we are in a position where we have an in-house pharmacy and we have a dedicated pharmacy staff member that will do all the predetermination once a patient has received a script for Apretude by their provider after they've had their consultation, like Nancy was mentioning earlier. However, there's sometimes no guarantee of payment. And we have a working group that troubleshoots. We meet weekly and we review cases, and we try to, alongside with the PrEP navigators and the PrEP specialists, try to come up with solutions for them, whether it's to go back to doing oral PrEP or trying to apply for patient assistance programs. We sometimes just have to get creative with patients, especially when they're traveling. We see a lot of movement within the Washington, D.C. area. This is a very transient area. A lot of folks are here for work, for school. They may change jobs. And so insurance coverage is always fluctuating. And so that has been a challenge. But one of the things that we're doing is to constantly monitor for insurance and medication coverage through our PrEP clinic, through our PrEP specialists, and specifically through the PrEP navigators. So that's what we wanted to talk about with you all today. If you have any questions, I do see that there's a Q&A portion, unless I'm misremembering in the agenda. But like we say here, like, ask us about PrEP. Thank you so much for allowing us to present this afternoon. And thank you once again. And I'm gonna stop sharing my screen now.
All right. So thank you, Kevin and Nancy, for that marvelous presentation on your programs. So now we're going to go ahead and open the floor up to questions. So if you have any questions, go ahead and drop them in the comment section. Or if you want to bring your device on mute and engage with us in this space, then feel free to do so. Hey, Juan Carlos, I see you join before another question come in.
Right on time.
Hi, good morning, or good afternoon, I should say. Hi, I'm Sean. I'm from Positive Impact Health Centers in Decatur, Georgia. Quick question. You mentioned the difference in the insurance billing, the medical versus the pharmacy.
Mhm.
In your facility, are you able to bill both or just one? Because I've been told the way we're structured, we can only bill as pharmacy and not medical with the Apertude.
So as far as I know, we're doing both medical or pharmacy benefit. Pharmacy benefit, it's a lot more straightforward. Medical benefit, it's a little bit more complex, and that's where we're seeing a lot of challenges, particularly with CVS specialty for medical. So I think that a lot of clinics and other places, if unfortunately, I think it's a matter of like resources. And like I mentioned, we have a dedicated pharmacy staff member doing all of this work. But of course, like if a clinic does not have like a 340B pharmacy program or access to a pharmacy, like it's a lot more challenging and more complex. So I can see why a lot of health centers are not, they don't have the logistical support to be able to troubleshoot and review on a case-by-case basis and be able to get that reimbursement for a medical benefit. But for sure, medical benefits a lot more challenging than pharmacy benefits.
Great, thank you. Appreciate the input.
Thank you, Sean, for that question, because we are seeing a lot of challenges, like I mentioned, particularly with CVS Caremark and CVS Specialty Pharmacy.
Hey, Kevin. So during the registration, I did ask the participants, including questions they might have for you all. So I
Sure.
want to bring this one out that popped out to me. Are you able to offer injectable PrEP in mobile units?
At this point, we are not offering injectable PrEP through the mobile unit, mostly because when someone expresses interest in Apertude, they're doing a consultation with a provider. Then we're sending a script to the pharmacy. Then our pharmacy technician person is following up, doing the predetermination, essentially like a benefits assessment. And that can take, including if need be, a prior authorization or an appeal if there's a denial for a PA. So that can take anywhere from 4 to 6 weeks. So it's not a timely process as it would be with oral PrEP having access to starter packs or, same day approval through Gilead's patient assistance programs, patient assistance program. So unfortunately, we just don't have the ability to do that at this moment, but I know that that's something that
I would say that, yeah, if I may
Yep.
add to that, I would say that that will be our dream come true. That's our goal in the near future. I think if the insurance aspect changes, that will be a big difference. We are contemplating partnering with a few CBOs, local CBOs who are not able to provide health care services, and if those patients are in Apertude with us, we can do the maintenance those perhaps utilizing the mobile van, so they won't have to come in here. We can do that way, but starting same day Apertude, that will be a little difficult.
Thank you, Juan Carlos. And thank you for the question. That for sure is our dream and goal. I do see some questions in the chat here as well, Roderick, if I may read, if we have time for some of them.
Yeah,
Because
no, absolutely.
there was a question about the oral lead-in that's prescribed for 30 days for bridging. So a lot of our patients, since these injections are being done through the PrEP clinic, a lot of these patients are already on oral PrEP, whether that's TDF or TAF. So providers are more so concerned about if there's like a missed appointment window, especially during the loading phase for Apertude. So for Apertude, you do an injection 3 to 4 weeks out. and then every 2 months. But there's always like a refill available at the pharmacy in case someone's traveling or they miss the appointment window, or there's like issues with like getting the medication through something like CVS specialty pharmacy. And I do see here other comments about some folks, especially a question about how can we make dispensing PrEP more appealing to them, to CVS pharmacies. So that's something that we're currently trying to figure out as well. As we've said, we've seen some inconsistencies with CVS Caremark and CVS pharmacy specialties. So definitely, I think there is a component of patient advocacy as well. So thank you for the questions and the comments.
Right, and Clay Porter has their hand raised. Clay, did you want to unmute your device and ask your question?
Yeah, so I saw you guys do rapid PrEP in the van and at the clinic. In order to have someone leave with PrEP, you're using samples, or do you pay for and just like have PrEP? Because so basically, the reason why I'm asking the question is because I'm getting ready to get samples delivered to. We're getting ready to start doing it in clinic, and then I'm trying to figure out, once my samples are gone, how am I going to do rapid start, or how do we just buy it in bulk, or what?
Yeah. Go ahead, Jason.
I can take that one. Yeah, so we partner with Gilead for those samples. So that will be Discovery, the starter packs. So they have those, I think it's 7-day samples. And I think as of right now, I think you can continue to request those. The only thing is you need to, a provider has to request it, right? Make the request. And you can, if you have a few providers within your clinic, a few providers can sign up for it and have a tracking process. So what we do is we, like, in a monthly basis, Gilead comes and provide those to certain providers, and we keep them in stock.
Okay, perfect. Thank you.
I will also add that in many situations where patients are uninsured, by utilizing the online platform, we're able to sign them up for a patient assistance program. And since we have a pharmacy in-house at both of our locations, we're able to do that process within the same time that the appointment is happening, in addition to the starter packs.
Perfect. Thank you. That'll be good too, because I'm going to experiment with my first client who has insurance, and then my second client without. So that'll be great. Thanks.
Definitely. Thank you for the question. There's another question here from Nicole about patients that are not able to tolerate Descovy and being able to provide Truvada generics. So we don't have any Truvada generic starter packs available. They are just Descovy, like Juan Carlos was mentioning. But thank you for the question, Nicole.
All right, Kevin. So I'm going to go ahead and throw out another question from the registration. So how are PrEP users being referred for testing through the use of the mobile health services? And I'll also add, how are the users also, like, what's this, how PrEP users being referred? So yes, how are new PrEP users being referred for testing through the use of mobile health services?
Yeah, that's a really good question. So that's through our health educators. So our health educators are essentially community health workers who specialize in providing education and counseling for HIV and STI, sexual health and prevention. And so for the mobile health unit specifically, or when we're having mobile health events, as we call them, MHI events, the health educators, they are very important and pivotal to actually being the bridge, right? Like the link between community and clinic. So similarly, for folks who are coming from the mobile health initiative, to the medical side of things, there's always a health educator. Now, these health educators have like specific titles. Those that are in clinic doing the PrEP care follow-up, they are called the PrEP specialists. Those that are out in the community with the mobile ban and with the mobile health initiative are the community partner outreach specialists. We love long titles, like I mentioned here with Walker, but essentially having community health workers that specialize in these areas to, link, be the bridge between community and the clinical setting is key.
So we have time for maybe one more question. If not, then we can go on to the next activity in the breakout group session. Okay, I'll throw out one more from the registration. So how do you meet new CDC testing guidelines for HIV RNA for follow-up for PrEP visits with mobile health services?
I will defer this answer to Juan Carlos.
Sorry, can you repeat it again?
Yeah, no problem. So how do you meet the new CDC testing guidelines for HIV RNA for follow-up PrEP visits with mobile health services?
Yeah, so we are still doing the 4th generation blood draw. We are having some issues for insurance actually to cover those tests. Right now we are back and forth with this conversation with insurance. And now we work very closely with LabCorp because we subcontract with LabCorp. So we are working closely with them to add the modifier 33 in some of those tests. And so insurance cannot kick back. So we are not completely adherent to in that regard with the test until otherwise we'll confront like a lot of bills to the patients if we move forward with that test. So for as of right now, we're doing the 4th generation still.
All right. Well, thank you so much, Kevin, Nancy, and Juan Carlos for tapping in. It's so good to have you guys in the space. So what I'm gonna do now is I'm gonna go ahead and share my screen again. In preparation for the breakout group activity. I was kind of moving a little quick and I didn't go over the purpose of the PrEP Navigator group. So just really quickly, again, we got permission to be able to open the group up outside of the EHE phase 1 jurisdiction. So now the group is open to NASDAQ members and community level staffs who are PrEP navigators. This space is for people to meet and discuss topics impacting PrEP access, share resources, and learn from each other. And so in preparation for the breakout group, and let me also do this. There we go. In preparation for the breakout group, we want to, get everyone in the room together to start having conversations about some of the services that you offer so you can get familiar about the people who are in the space. So just a couple of different PrEP delivery models, and you can find more information on the PrEP delivery models in our TelePrep online learning series. I should have included a slide with the information, but we'll make sure to send that information out to you all. And so a couple of different PrEP delivery models include traditional medicine plus programs. And so the plus is the telehealth piece. So telehealth, TelePrep comes in as more of a supplemental thing for traditional medical care. Their state departments help the program. So if there's this local state health department that has a PrEP program or a clinic or a sexual health clinic, that usually falls under that. Then we have a public health extension. With the public health extension, usually that is our CBOs, our SCE clinics, our sexual health clinics. And then finally, we have contracted/private. So usually those are the ones that are partnering with health departments and CBOs, and they might do home testing and labs and things. And so for the breakout our group session, what we wanted to do was to talk a little bit about your PrEP delivery model and kind of have some conversations about that. And so here is the questions. I'm going to let Nicole begin to divvy up the group. All right. Everyone should have returned back from the breakout session rooms. I hope we peep it in just to make sure that everyone was good and had access to the questions. And we heard some really, really good conversation happening. So we were hoping to get maybe some feedback on the conversation you had, anything that anyone wanted to share about what you learned about some of your peers in this group before we close out. So feel free to take your device off mute. See, there's some comments coming in the chat. Yes, it was good. I wish we had more time. Okay, noted.
Yes, I couldn't agree to that one because honestly speaking, we only had the opportunity to answer basically the first question. We did, and then we had talked to Gerald, because since he's one of the people up in Massachusetts from the organization that pretty much funds approved applications for PrEP medications, so that was good to know. And we pretty much basically all do similar situations. The only thing that that I don't do is that I don't go out in the field. So I'm specifically in the clinic, so to speak. Well, not so to speak, I'm in the clinic. So, and what I mean by that, when a client comes in stating that they think that they've been exposed to an STI, I'm the first person that they see before anybody else. Whether medical assistants or the nurse or the doctor, to assess them, and then help them move forward from there.
Thank you for sharing that. Any other responses? And it's noted that y'all didn't have enough time, so we might consider having a session just for us to kind of get better acquainted.
Yeah, I think it was great just to hear what other people are doing around the country and trying to come together in the middle to find out to think about if some of what we're doing in any given part of the country might be doable in other parts of the country. Because we talked about the intravenous drug use population, and they're a hard sell apparently in the South as well as in Cook County, Chicago. So yeah, we would definitely need an entire part 2 just to talk about that group.
Okay, so I'm gonna go ahead and notate that. Thank you so much. Is it Taiwan?
It is Taiwan. It has been a while since somebody said that right the first time.
Alrighty, anybody else would like to share?
I'll share. I had the pleasure of being with Pierre from Dallas, Texas, and also someone else who was an epidemiologist. And Pierre was sharing with me about their outreach model and the mobile unit that goes out in community to link those folks to their clinic. They're also doing injectable PrEP and oral PrEP as well. And we were also talking about stigma, especially with heterosexual individuals. And we were also talking about PrEP access for cisgender heterosexual Black women as well, which have not traditionally been reached before. So we think that that's also a very important discussion to have in spaces like this.
Indeed. We didn't have time for some of the other questions that were placed on the registration, but I did get a question in about increasing PrEP uptake with women. So that will be a topic that we can unpack a little bit more in future sessions for sure. All right, we might have, wow, I don't want to open that. One more response and then we can go to close. Anybody else want to share?
Yeah. This is Jerry from Massachusetts, Access South MA. And I think this just ties into what you said about the question about PrEP uptake in women. I think, and I'm just generalizing, I think the issue is that we're not in the right places for women. You know, we're in different clinics. We need to be in OBGYN. We need to be in family planning to talking about PrEP. I mean, a lot of people are working in STI clinics and IV clinics, and that's wonderful, but that's not the key spot where women are going to get their primary care and services. It's those other areas, and that's what we need to figure out collectively, how to get into those areas or bring those providers who do work in family planning or OBGYN and get them more educated and get them to start talking about PrEP in addition to the service that client or patient came in for.
Thank you, Jerry. I was just having a similar conversation about reaching women in terms of PrEP access. And I think that is important to include reproductive health or to integrate PrEP into reproductive health conversations, but also in terms of like how we outreach to people for the gay and bisexual and queer community. You know, a lot of organizations make sure they're present for PrEP, but are there any events that are catered to women that we're also president? Like for Sister Only is the event that happens in DC. Do we have our presence there? So it's a lot to like chew on, but yeah, it's funny. I was just having this conversation. So thank you for your response. And so what I'm gonna do is I'm gonna go ahead and close us out for today. All right, so the next session is going to happen in November. We had planned our sessions all the way up until now, and because I've been traveling a lot this month, and we also had the USCHA conference, I haven't been able to meet with the PrEP Navigator peer-to-peer group to do some additional planning. But we are, the goal is to host this group every other month. So the next session will happen in November. I'm probably going to definitely suggest to the team if we can to do that well before the holidays start to commence, because we know that people like to take off of work for the holidays. So we'll probably do it early November, but we'll definitely send them out. We'll definitely release a memo with the new confirmed date and registration. And for more information, you can use this QR code to sign up for the PrEP Access listserv, and you'll be able to receive updates on what we're doing with general PrEP access and the PrEP portfolio and that set, as well as the PrEP Navigator peer-to-peer group. And then finally, I didn't finish the slide, but I'll talk that one through. We do provide technical assistance for anyone who is an EHE jurisdiction member and also a NASDAQ member. So if you are part of the EHE or member of NASDAQ, and there are certain topics that you want to have some dedicated time to work with somebody on, feel free to reach out to myself or Nicole for the technical assistance. As always, we will send the recordings and the slides to everyone. We're in the process of planning of, trying to have like a central hub to place everything for you all to access at any time that you need, but we'll definitely email you this information in the meantime. Thank you to Women Walker Health for coming to present on their wonderful programs. It was great to have a little mini reunion with you all. Shout out to Warren Carlos, Kevin, and Nancy. And thank you, Nicole, for all your help with the breakout sessions and the planning of the group. And we look forward to seeing you all in November.
Thank you for having us. Bye-bye.